Hi everybody, my name's Stacey Dolliver and this is my presentation for Exercise and Sport Psychology. Discuss the potential positive and negative psychological effects of anabolic steroid use. What we will look at today is a definition of anabolic steroids, the general public perceptions of anabolic steroids, typical anabolic steroid users, effects of anabolic steroids on athletes, and the positive, negative psychological effects of using anabolic steroids. Anabolic androgenic steroids, AAS, known as anabolic steroids, are man-made versions of the primary male sex hormone testosterone, which is responsible for the masculinization and muscle growth during male adolescence. The general public may think of high-level elite athletes cheating to progress in their sports when the words anabolic steroids are mentioned. The words drug cheats and doping may also come into mind. I'm sure all of you have seen in recent media numerous sports being scrutinised for drug scandals, not just in Australia but also worldwide. A 2007 study revealed that a typical anabolic steroid user is Caucasian, approximately 30 years old, highly educated, and a gainfully employed professional who earns an above average income. These individuals are not active in organised sports and they are not professional athletes aspiring to win world titles. The typical anabolic steroid user in this report were regular people who used steroids to gain increases in skeletal muscle mass, muscle strength, and physical attractiveness. They used the anabolic steroids in conjunction with a carefully planned routine of diet and exercise. This 2007 study was an internet survey which may bring about questionable validity. It also may have drawn out, though, more honest answers than face-to-face interviews would. In addition, there were 1,955 respondents, which is significantly higher than other studies. The effects of AAS on athletes. Athletes use AAS for their muscle building and performance enhancing properties. Research is limited on the effects of AAS on athletes because it is considered unethical to do studies that simulate the high doses of steroids that are actually used in real life in scientific studies. Positive psychological effects. There are many documented positive psychological effects of AAS use, such as reduced negative mood states relating to fatigue, depression and self-esteem, and increased feelings of well-being. In addition, users have reported feeling good about themselves while on anabolic steroids. A study into the effectiveness of AAS use in athletes in 1999 reported a number of positive psychological effects. These were described as an increase in mental alertness, increased aggression, increased confidence, increased peer recognition, increased social status, more tuned into their bodies, and even being effective in the workplace. A participant in this study said, "I was being accepted by a lot of bigger bodybuilders." Another participant said, "I'm a lot more energetic and aggressive. I'm a lot more confident. I tend to be more cut when I'm on drugs, so I tend to look a little better. My muscular definition is coming out. My strength is increasing. I'm obtaining goals and feel great. I can do anything. I feel better, I'm stronger, I'm on top of the world." On the flip side, there are also many documented negative psychological effects of AAS use. Some of these are mild irritation, uncontrolled aggression, hostility, depression, and mania. Following on from that, there's also been reported paranoid jealousy, extreme irritability, delusions, and impaired judgment stemming from feelings of invincibility. A 1988 study conducted structured interviews on 41 bodybuilders and football players who had used steroids. Of these, 39 were men and 2 were women. 12% of these people displayed psychotic symptoms while using the steroids. They reported things like hearing voices, developing paranoid delusions that friends were stealing from them, developing delusions that they could pick up a car and tip it over, and also developing delusions of reference. Manic behaviour was also reported. One of the individuals in this study was videotaped driving a car into a tree by one of his mates. Another person impulsively bought a $20,000 car and when coming off the drugs realised that there was no way he could possibly afford the repayments on a car of that level. And many believed that nothing in the world could hurt them. The users who were experiencing these symptoms were stacking between 2 and 4 steroids, meaning that they were taking multiple steroids, mixing oral and or injectable types, and sometimes including compounds that are actually designed for veterinary use. All psychotic symptoms disappeared when these individuals stopped taking the steroids. However, 12.2% developed major depression during the withdrawal process. The study concluded that the doses of steroids used in real life are between 10 and 100 times more than those used in medical studies. The effects of these drugs must be observed in a natural setting to be able to fully understand them. It is unlikely that a medical study can ethically replicate these high doses. Another study in 1994 of bodybuilders reported similar effects of hypomania, manic episodes, depression, and suicidal thoughts. In conclusion, AAS at high doses may produce neuropsychotic symptoms, but the prevalence is low. The frequency of these events is largely dependent on the size of the dose and the length of use. The psychological consequences of anabolic steroids are far more damaging than the physical side effects, both while the steroids are being used and also when an individual stops taking them. Ultimately, it comes down to freedom of choice for an individual to be able to put anything they want into their body as long as it does not affect anybody else. However, research concludes that the negative psychological effects far outweigh the positives. However, many of the people who take these drugs consider that the positives outweigh the negatives and are prepared to put their bodies at risk for the benefits of the drugs. Here's just a little comic strip from the Herald Sun. And the following 3 slides are my references used in this presentation. Thank you very much.